So this topic is about the synovial joint. So how we define the synovial joint in the diagram? It has been observed that in the muscle there is a ligaments, a joint capsules that is present inside, and that is connected with the synovial membrane. Along inside there is the bone marrow. There is also a anticular cartilage present in the yellow color. There is the joint cavity, which is known as the synovial fluid. Inside the yellow color, there is the compact bone and a spongy bone. So, firstly, we define the friction. Basically, friction is the resistance to movement between two surfaces in contact. In joints, it occurs between opposing articular cartilage surface. So this is the friction of the joint. For example, in the damaged cartilage, there is the inflamed synovial membrane. So the friction and pain will be observed between these two bones, which is called the osteophytes, and it reduces the joint surface. There is the importance of the low friction, like it allows the smooth movement, reduce the wear and tear of cartilage, prevent the joint degeneration, and maintain the joint efficiency. There is some articular cartilage, like it can define as the smooth white vascular tissues which cover the end of the body, and it is made up of collagen fibers, protoglycans, and the water. It provides a smooth, low friction surface. This is the picture of the articular cartilage. Basically, it has been present between the femur and the knee joint. There is the joint which is called the articular cartilage. There is the role of the articular cartilage. It reduces the friction, absorbs the shock, distributes the load evenly, and protects bones and there is the lubrication, like lubrication is the mechanism that reduces the friction and wear between the joint surface. For example, the lubrication of joint, for example, there is the synovial membrane present between the smooth cartilage and the normal joint surface. So there is the lubrication of the joint which create the friction. So what is the synovial fluid? That is the thick viscous fluid secreted by the synovial membrane. It fills the joint cavity and acts as a lubricant and nutrients medium. There is a composition of the synovial fluid like the water, hyaluronic acids, lubricants and proteins and the nutrients. There is the functions of the synovial fluid, like it reduce the frictions, nourish the articular cartilage, absorb the shock, and remove the waste products. There is the types of the joint lubrications, like boundary lubrications. It occur at low speed and high load. Lubricants coat the cartilage surface and prevent the direct surface contact. There is some fluid film lubrication, like a thin layer of synovial fluid separate the joint surfaces. It occurs during the fast movement and very low friction. There is elastohydrodynamics lubrications, like cartilage deformed under load. It maintains the fluid film and important in weight-bearing joints. There is a joint disorders like osteoarthritis damage the cartilage, it decrease the lubrication, increase the frictions and the pain. So this picture observing the two which have been the pain joint and the normal joint. There is some clinical importance, like it help in understanding the arthritis, important for physiotherapy and rehabilitation, and it's been useful in the joint replacement designs. As a conclusion, diarthroidal joints have extremely low friction achieved by articular cartilage and effective lubrication mechanisms, so it has been essential for painless and the smooth movement.